Hello and welcome everyone. I'm Ananya and we have very warm guest with us, Dr. Sarangi. Dr. Sunandita Sarangi have been my known person and a very warm person. I've known her for about 14 years now. And she has completed her PG diploma from Annamalai University and specializes in a medical cosmeceutical, basically. So we will take all possible tips and tricks from Dr. Sarangi today of how to take care of our skin, which is the biggest organ covering our entire body. So welcome, ma'am. Over to you if you would like to introduce yourself.
Hi everyone. I'm Dr. Sarangi. I'm practicing in Kolkata, and I'm very much interested in cosmetology practice, though I am a skin specialist. But nowadays, I think everybody is so much concerned about their beauty. So, in a medical way, I want to make them beautiful in my own skill.
Perfect. Yeah. Thank you so much, ma'am. Welcome once again. So I will start with few common questions based on the age group. First question would be, from which age group do you think that a person should start taking care of their skin and hair?
Actually, Ananya, just after birth, we should take care of our skin. As a baby can't take care of their skin, so mother or somebody from their family should take care skin properly. Because the skin is the largest organ.
Absolutely.
It's not means part of our beauty is protecting our organs. It's protecting from a lot of injuries from outside. It also helps to excrete lot of toxins from the body, and it is also a thermoregulatory organ. Means only through our skin we can feel it is cold or hot. So it is a very, very important organ in our body. So it's not that you'll have to take care a lot for your skin, but according to your age, you should consult with some skin specialist and use only those things which you need. So simple a neonate till 6 months, we are advising they don't need anything. But day by day,
now how do we take care of our skin
for a neonate? That a neonate can take care, but parents should be very aware about their skin.
Right.
Yes.
So, in general, how do we take care of our skin?
Yes, Ananya, I can't hear.
In general, how do we take care
you
of
need
our
a proper cleanser to clean up your skin. You need a good moisturizer. And according to your age, I suggest after the age of 14 or 15, you need a sunscreen. That's enough till the age of 25, 26. After that, we can add some more cosmeceuticals or medicines. But in general, if a person can follow through a cleansing, moisturizing, and uses of proper sunscreen, skin will be fine for a long time.
Awesome. Great. Okay, let's get on a call and we'll do a audio call with ma'am and we'll take her gist through the call itself. I'll put it on the speaker so that we can all hear ma'am's answer. I think that can be a best way to reach her out, not missing on her appointment because she's a very busy person. And I'm not sure when we'll get her date again. Let's see if she can pick up the call and she can help us.
The person you are calling.
Oops. We'll wait.
Yeah,
yes, ma'am. I'm so sorry. We lost you on the video. Shall we do it on the audio itself, ma'am? You can at least answer the questions. Yeah. So I'll keep on the audio.
Yeah.
Yes, ma'am. I think there is a slight network issue why it is keeping on hanging. So we thought we'll continue this over the phone itself. So, ma'am, we left on the neonatal care. So, a neonatal child can't take care of himself. So, the parents should take care by moisturizing their skin, right? And
by proper cleaning and then moisturizing.
Right, a proper cleansing and moisturizing is what a neonatal care needs. Then, coming on to the adolescent age from 14 to 18, a person should follow a regime of cleansing, moisturizing, and a sunscreen. Am I correct? Absolutely. Now, coming to the age group of 20 to 30s, what are the kind of.
Actually, in adolescent age group, means the 12 age plus,
Okay.
you need to take care of your skin because there are a lot of hormonal changes in our body.
Exactly.
Then adolescent boy or girl may suffer from acne. If there is any hormonal imbalance, they may suffer from a lot of dandruff or hair fall. Sometimes body hair growth, which is actually known as hypertrichosis or hirsutism. So we can't ignore all these problems also, because in this age group, as you know, that people are suffering from a lot of stress also, their educational stress.
Right.
And
absolutely.
That time, and what every day in my clinic, I am going through that, and I am just watching that they are not cleaning their skin properly, even their scalp.
Okay.
So that is the most common cause of development of all these problems, means the dandruff and the pimple and lot of scars also, because they want to look good. That's why they are handling lot of quality methods to get rid of this thing.
Right.
So if somebody can take care of their skin 12 onwards in a proper way, this cleaning is the best treatment in this age group to get rid of all this kind of problem. So you have to select the proper cleanser.
Right. Okay. So, and I would also insist here, ma'am, just to help us understand, cleanser, like those with all the, the marketing and the advertising is done mainly for the commercial products. But what I have learned from you is we should always rely on a cosmetologically medicated, well-tested product, right? So,
Absolutely.
Right. So we should.
As the skin is an organ. If we have any problem in our eye, our heart, or gastrointestinal tract, we should follow the advice of a doctor. So
Absolutely.
in case of skin also, if you want to keep your skin healthy, then you also follow a proper guideline which actually advised by a doctor.
Right.
So if your skin is even normal, then and there also you choose your cleanser properly with the consultation of a doctor or a skin specialist, because you don't know which cleanser will be suitable for you.
Right.
And if you have a problematic skin also, then also you have to choose a cleanser according to their advice.
Right, ma'am. Absolutely agreed to you. That's what even I have learned over the years with you. Now, coming to the age group of 20s to 30s, what are the advice that you would suggest? What are the tips and tricks that a person between the age group of 20 to 30 should follow?
20 to 30, in this age group, mostly the people are going outside, means for their job purpose or maybe some
higher
other
studies.
So,
right.
Yeah. So this is the time when you should follow, along with all this cleansing, moisturizing, you should acquire a habit to apply sunscreen properly, because sunscreen has it's a very important role in our skin. It's a myth that we are not going out, that's why we don't need sunscreen. It's not true, actually.
Right.
So actually sun has a lot of good factors for our skin, but we have to protect our skin in a proper way with the application of with perfect sunscreen according to your age group, according to your job profile.
Perfect.
If somebody is working a whole day in front of laptop, then also they need a sun. If somebody is traveling, is going to beachside or hill station, they need a high speed sun. So that also you can choose only with the
help of
consulting
a
with a doctor.
right,
Absolutely.
right,
Okay.
right, ma'am.
So every day, when a lot of my patients are asking that it's a very expensive sunscreen and it contains this and this, so it's written it's a broad spectrum sunscreen, but we are not advising to apply a broad spectrum sunscreen of everybody. So if you're an athlete, then you need a broad spectrum sunscreen. Indian skin type need mostly 16 to 20 SPF sunscreen. That is enough, more than enough.
Okay.
But you have to follow the rules that you need to apply the sunscreen every 2 hours interval.
Right. Reapply it every 2 hours. Right. Absolutely.
Even if you're swimming, then you choose a water resistant sunscreen. These are some important things that it is possible if you can consult with the doctor. And then and there you can choose your sunscreen.
Agree to you, ma'am. Now, coming to 30 plus onwards, people start aging. People's cells, body cells starts degenerating. So, what will be your suggestion for people post 30 plus onwards? How to take care of their skin so that the degeneration process can be at least taken controlled of?
Absolutely. Actually, you know that the aging process is starting from the age of 29. But at those period of time, we all of us so busy that we forgot to apply our proper moisturizer, sunscreen, and cream. So if we delay this procedure for 10 years more, then and there only you can see the development of wrinkles, some kind of pigmentation. Means your skin is not having a proper skin tone. There are a lot of freckles kind of pigmentation, some kind of melasma. So then it is very difficult to treat. If you are not taking care of your skin 29 onwards, then this is the perfect time to start an anti-aging treatment or anti-aging procedures. These days, a lot of procedures we are doing, like the chemical peeling treatment, some kind of IPL treatment, and microneedling. So if you just aware of your skin, so you should go through all of these things, consulting with your doctor that which kind of moisturizer you need, because at the adolescent time you need a certain kind of moisturizer which is not that much oily, but 29 onwards we need an extra moisturizer.
Okay.
So yeah.
So, ma'am, what is the difference between a peel and a derma roller? What would be the difference between the procedure of a peel and derma roller, and whom would you suggest a derma roller and whom would you suggest a peel?
Actually, peeling is a procedure which is exfoliating our dead cell layer. There are a lot of medicines which are using in the peeling treatment which help to reduce the pigmentation, because those medicines are actually so strong that they can penetrate to our layers of the skin.
Deeper layer of the skin.
Deeper layer of the skin, absolutely. Right. So in peeling treatment, we are using a different kind of medicines like glycolic peel, which is actually very good for as an anti-aging treatment to reduce the pigmentation. We can use a salicylic peel, which is good for acne treatment. And there are other treatment also like lactic acid peel, maldolic acid. These are excellent medicines which we can give for our skin to treat lot of things. Like it is not possible to make a skin fair, but it is possible to make it blemish free.
Right.
Okay. So only medicines can do all these things.
So for that, you also would suggest that internal, what food we eat, how good our gut microbiome is, what is our gut health, would also cooperate to all that what we look from outside. Just doing the peels won't really help. It is also what we are eating, what our body contains also really matters. Right, ma'am?
You know, the skin is the mirror of our body.
Absolutely.
If your body is not working in a proper way, if your hormone is not okay, it is totally reflecting to your skin. You can see if somebody can sleep throughout the night, and after a few days, you can see there is a lot of development of dark circles, the under eye puffiness, loss of hair fall also.
Absolutely.
Okay, so everything is related with our
internal systems.
Absolutely. And where the food exercise, everything is very, very important.
True, ma'am. And one more last question, ma'am, I would like to understand. Since there are so many more people who are also taking up fillers and Botox treatments nowadays, especially in 50 plus age group, what would you suggest? What are the side effects? What are the benefits? If you could just brief us a little bit, just for our viewers to understand the differentiation and then accordingly talk to their dermatologist, it would help people to understand the differences.
See, Anuna, it is depending on your profession. If somebody is acting is somebody's profession, then you can opt for those procedures because that is their bread and butter. Okay, they have to look good in front of the camera.
Absolutely.
But if somebody is coming to my clinic at the age of 20 and 22 and asking me to do some Botox and fillers only to enhance their beauty, being a doctor, I will not suggest to do all those. There are a lot of things you have to think about before doing all this kind of treatment.
Perfectly.
Okay? As all those medicines, they are good. But if you are not following all those in a proper way, they are poison.
Right.
It's not that I will go for a Botox treatment and after that I will be absolutely fine and I will look like 20 and 22. It is not possible.
Absolutely.
So there are a lot of things to enhance your beauty along with all the treatment. The ultimate stage is the Botox, and these fillers is good. I will not say that it is not good for us, but the same thing. If somebody is coming to me at the age of 80 and 18, 20 and asking for fillers just to make their lip to look good, I will not do if they are a student.
True. Absolutely, ma'am. Agreed with you. And of course, there are certain side effects also, which I would like to know from you. Like, especially when a person is going through all these chemical injections, which are inserted in their bodies, there are many other fluctuations which happen, which interrupt with their normal, day-to-day living or the normal core of their body, which interrupts. So, have you come across any such cases, ma'am, where because of a misuse of these chemicals, people have come across some, drastic toxicity or something like that?
Yeah, even the chemical peeling procedure. I got some of my abroad patients who are actually getting a lot of pain medicines throughout all these kind of Amazon or Flipkart. But they are applying all those on their skin, like glycolic acid and salicylic acid. And after a certain period of time, they are facing a lot of problems because only a medical person can know how much strength you need because glycolic acid also a lot of strength, like 10%, 20, 25, 30, 70. Okay?
Right.
But Indian skin tone, we don't need very higher kind of glycolic acid because your skin type is mostly 3, 4, 5. But a European person, they need one, as they have a 1 or 2 type of skin tone, they need maybe 60 or 70% glycolic acid. So some of the person who are staying abroad and they used to take 70% glycolic acid in a regular basis, that is a very much harmful for their skin. So don't try anything of your own. Only searching up all
for
these
a beautiful
and
look.
all these,
just for that time.
Yeah, some of my patients are doing derma roller of their own also.
Oh my
these
God.
are not advisable. These are not advisable to do. If you are really concerned about your skin, you should visit to a clinic and do a chart according to your issue. A chart of your medicines, chart of the nutrition, and your proper exercise. Then if you follow this from the age of 20, I think 50, 60, you will be absolutely fine.
Right, ma'am. Even I would reiterate on this point what you said last. Even I believe that, and since I have been your patient as well, You also know I have tried experimenting. I really, ma'am knows the best. I have tried experimenting with all the natural ingredients and uptans on my face. Yes. But then
we are also prescribing aloe vera. That is good for our skin. That is a good moisturizer. But you have to select it in such a way. Our skin pH is 5.5. So you have to make the pH level near to our skin pH level. Otherwise, it will give you a lot of irritation, and later on, it will make your skin sensitive.
Breakouts and all these stupid things will happen. Right,
These are
ma'am.
all signs of if somebody is coming to me at the age of 20 to 23 and I just check them that they have a lot of pigmentation, their skin is red, and they are complaining a lot of itchiness. That means they have applied a lot of things of their own, and now the skin is very sensitive.
Right, ma'am. So basically, where we come back is to our old roots that we should eat healthy, live healthy, go out in the sunlight and open, and get a little morning sunshine so that our bones are working fine, and try and take advice of a specialist instead of experimenting on ourselves.
Absolutely.
Right?
You know, everything needs some discipline.
Absolutely.
If you follow the rules, you will win. You will get a very healthy skin till the age of 50, 70.
Correct. And all of this will only come with discipline and with a proper routine. So kindly, this was such a lovely session with Dr. Sarangi. We really thank you so much, ma'am, for all your tips that you have you've advised us. I hope all of you will follow and not experiment on your skin and on your life. Please take help of your specialists. And thank you very much, ma'am, for being with us on my channel. Thank you, and have a great evening. Bye-bye.
Thank you.
Thank you, everyone. Signing off, Ananya.